I'm Mary Jo Larson. I'm a senior scientist at the Institute for Behavioral Health inside of Brandeis University.
What prompted the military healthcare system to change the way it manages patients' pain?
So the Army in particular was concerned about their ability to respond to the acute and chronic pain needs of service members, particularly service members coming back from deployments. They also were concerned about an increase in suicides among active duty service members. And when they looked at people who were committing suicide, they realized one thing they had in common is that they often were treated for chronic pain and had been receiving long-term opioid therapy. So they embarked on a one-year study and discovered that providers in the system also felt that their ability to respond to acute and chronic pain of service members was inadequate, and that there wasn't a standard protocol, and that they could measure the occurrence of pain in a better way and develop more non-drug therapies.
What is the culture of pain awareness within the U.S. military?
A culture of pain awareness in the military, and I think this is terminology that they use, and I think it comes from this concept that the military is your home. It's not just where you're working, but it's also where you're getting your health care, and they want to promote this military-ready, mission-ready force, which means total force fitness. So it's more than just being physically fit. It's being psychologically fit, emotionally fit, and being aware of pain and how it's interfering with your mood, how it's interfering with your sleep or with your capacity to do your duty. That's a piece of what service members need to be able to do and a part of what the health system has to respond to.
How has the military healthcare system been an innovator in pain management?
The Army's put a lot of focus on the capacity of providers to respond to chronic pain. And in particular, they tried to enhance the capacity of primary care providers in patient-centered medical homes. So they brought in some more specialists, such as physical therapists and clinical pharmacists, to the patient-centered medical home. They also are trying to do better at implementing care where people will be advanced to another level of treatment, more intense treatment if that's needed. And part of that has been to establish these integrated pain management centers that are specialists in handling pain that's become chronic and kind of treatment resistant. So those centers, there's eight of them across the U.S., have brought in interdisciplinary and multimodal treatments to help people with chronic pain, to bring them back to full functioning as possible, to restore their functioning, and to do that with as low reliance as possible on opioid medications.
Can you tell us more about your research?
Our study is unique in the sense that we're looking at the whole Army population that's returned from a deployment over the last decade. So we're looking population-based at how many people experience chronic pain, how many people receive opioids at the beginning of their pain problem or at the end of their pain problem. So we are hoping to identify patterns of care that are going to be low risk and also have the best long-term outcomes for a population of Army soldiers. And because we're looking population-wide, we're able to look at combinations of therapies that might be less frequent and also look at smaller population groups. So women, for example, are 10% of the armed forces. And because we're looking at all of Army members that come back, we have over 60,000 women that we can study separately from men and look at their experience with opioids and non-pharmaceutical treatments.
For more information, please visit nccih.nih.gov.